Your skin is a window into what's happening in the rest of your body, and the skin is one of the many systems that's affected by diabetes. Keep watching to the end and I'll tell you about some of the ways you can treat some of these conditions at home. Acanthosis nigricans. This is thick, darkened skin that has a velvety appearance. You usually find it in the folds and the creases of the skin, like the neck, the armpit, and the groin. You may also find it on the side of the face and the knuckles, the back of the hands, and on the feet. The skin isn't painful, but it may have a slightly unpleasant smell and it may be a little bit itchy. Acanthosis nigricans is very common in conditions where there is insulin resistance. This would include polycystic ovarian syndrome, diabetes, and obesity. It can also occur with use of certain drugs like birth control pills and corticosteroids, and it may occur in certain cancers like in stomach cancer. Diabetic bully or blisters. These look just like the kind of blisters that you would get from a hot water burn. The only difference is that they're not painful and there's no surrounding area of redness or discoloration. Left to themselves, these blisters will heal over 3 to 4 weeks. Please, please don't pop them because this exposes the underlying skin to infection. Digital sclerosis. This is a condition in which the skin becomes very thick and stiff. It mostly affects the back of the hands and the feet, but it can spread to other parts of the body as well. It's associated with the prayer sign where the skin is so stiff that the hands can't straighten. And the only treatment for this is to bring the blood sugar down. Very dry, flaky, itchy skin. Diabetics tend to have very dry skin, particularly on the hands and feet. This is because of the high blood sugar, the poor blood circulation, and nerve damage. Repeated scratching of this itchy skin may eventually lead to the skin breaking down, which exposes it to infection from outside. Shin spots or diabetic dermopathy. These occur on the shin, usually after some kind of injury, like bumping your leg against a table. And they don't heal well because of the poor blood supply in that area. They look like liver spots, but they're not, and they tend to heal over 24 months. Xanthelasma. These are fatty deposits that are usually laid down around the eyes as a result of high blood cholesterol, and high cholesterol usually goes hand in hand with diabetes. Skin tags. These are small skin-colored growths that hang off the skin. They usually appear around the eyes, the neck, the armpit, under the breast, the groin, and the folds of the buttocks. They're not the same as warts, and they're not the same as dermatosis papulosa nigra. They're painless, but they may become irritated by rubbing up against your clothes, and I'll tell you how you can handle them later. Recurrent skin infections. The combination of poor circulation, dry skin, and depressed immunity means that you're prone to lots of different skin infections if you're diabetic. The most common bacterial infections would be staphylococcal infections, which may cause styes on the eyelids, infections of hair follicles, and infections around the nails. Fungal infections occur in warm, moist areas of the body, like between the fingers and the toes, under the breasts, in the fold of the groin, in the corners of the mouth, and the nails. Candidiasis can also occur in these areas, but also in the mouth and in the genitals. Open wounds and sores. The most common would be the diabetic foot ulcer, and this occurs more if you're type 2 diabetic, if you're male, if you've had diabetes for 10 years or more, and if you've had an ulcer before, you are more likely to get another one. And some people actually discover that they're diabetic when they have some kind of wound or injury that refuses to heal. Nail dystrophy. This occurs when the nails become brittle and crumbly. And nails like this, especially paired with poor immunity, creates the perfect environment for fungal infections to take hold. And these can be very, very difficult to treat. Redness of the face or rubeosis faciae. This occurs as a result of disease of the small blood vessels in the face. And obviously in darker skin tones, this may not be noticeable at all, and there's no specific treatment for this. Vitiligo. These are light or white patches on the skin that occur more often in type 1 diabetes. They occur most commonly on the chest, the abdomen, but may also affect the face. So let's talk about how you can treat some of these skin conditions. And generally speaking, most of them will improve when the blood sugar comes down. So starting with diabetic blisters, like I said before, please don't pop them. I know it's really tempting, just don't. Because once you do that, then you expose the underlying skin to infection. So start by washing the affected area with warm water and a mild soap. Apply antibacterial ointment and cover with gauze or cotton bandage. You should avoid anything that will irritate that area, like shoes and clothing. You really need to see your doctor, especially if it's getting worse. For very dry, flaky skin, first of all, avoid harsh soaps. Use mild soaps that are intended for sensitive skin or for babies. You may also try a cream wash, and that's less likely to strip your skin of all its natural oils. Always use a moisturizing lotion or cream. Ingredients to look for include hyaluronic acid, glycerin, dimethicone, aloe vera, and urea. And these are great for absorbing and retaining moisture in the skin. Vitiligo can be treated with steroids. You can also try tattooing the affected area to try and restore some of that lost pigment. It's important that you use a sunscreen with an SPF of 30 and above to protect those areas as well. Acanthosis nigricans tends to improve by itself over time if you remove some of those conditions that were causing it in the first place. So that means that you would need to reduce insulin resistance through lifestyle change or medication. You'd need to lose weight, stop the medication that's causing it in the first place. You could try a topical retinoid like tretinoin or adapalene, and ammonium lactate can also help to exfoliate and thin out that affected area. You can actually remove small skin tags very easily at home. All you need to do is get a piece of cotton thread or dental floss and tie it at the base of the skin tag as close to the skin as possible. This cuts off the blood supply to the skin tag, and eventually it shrivels up and it falls off by itself. But skin tags can bleed very heavily. So if you have a skin tag that's big or that has a very thick stalk, you need to see your doctor for that. And if you want to find out how to prevent diabetic wounds and sores, watch this video next.